Hi, everyone. Thanks for joining us. Today's topic is navigating the future of revenue cycle management. I'm your host today, Naomi Kaduwela, head of Kavi Labs at Kavi Global, a leading data analytics and AI firm. And today I'm thrilled to be joined by two special guests, Cathy and Ganesan, who you're going to meet here in a moment. So thank you all for being here for today's live panel discussion from these two experts. Why don't we go ahead and have a quick introduction from them? Cathy, thanks so much for being here. Tell everyone a little bit about yourself.
To be here. I'm Cathy Lanier. I'm a registered nurse, practiced in a hospital for about 15 years and then stepped out and did consulting for the last 18. I'm a revenue cycle management expert in the mid-revenue cycle. I'm a nurse, so I work with nurses in the mid-revenue cycle space, and I'm very happy to be here today. Thank you, Naomi.
Thank you so much, Cathy. We are so excited to have you here representing the industry perspective and bringing all your years of experience and expertise. So thank you for everything you have done as a nurse. And we're really excited to have you join us today on a topic that I'm really excited about. I know there's so much innovation and opportunity, driving productivity here going on. So really excited to bring you here to the discussion. I'd like to now introduce our second special guest. We have Ganesan. Would you like to go ahead and introduce yourself as well?
Sure. Good day, everyone. Happy to be here. I'm Ganesh. I'm a director at RCM at Kavi Global. I do have around 18 years of experience in revenue cycle management and also exposure to payer operations and link right from quoting, then benefit management till to claims adjudication and payment services. Thanks for having me here.
Thank you, Ganesh, for being here and sharing your expertise. We're really excited to have you as well for the other perspective, bringing that technology expertise. As we know, we're shaping the future of work here. We're thinking about the future optimal human-machine collaboration in RCM. So it's fantastic to have your perspective here as well today. Thank you so much. To everyone that has joined us live, you will also have a chance to directly ask your questions to Cathy and Ganesh. Please put your questions in the chat as we go through. You can send me your questions. I will get to them at the end of today's prepared Q&A. And without further ado, let's dive in. Let's start with insights on the current industry landscape. What are some of the biggest challenges hospitals and healthcare providers are struggling with today? Cathy, why don't you kick us off?
Okay. Unfortunately, the healthcare industry is facing numerous challenges, particularly in the revenue cycle management. Providers are dealing with increasing regulatory complexities, rising operational costs, and the need for greater efficiency. Additionally, there is significant push towards value-based care, a whole nother thing they have to learn for physicians, which adds another layer of complexity for them. Managed payer contracts have timely filing and billing. That hasn't changed, but it's still there. If missed, the organization is timed out and will need to follow other avenues for payment. Staffing shortages are another pain point for our organizations, not enough help, and new staff who are learning the complexities of their job.
Absolutely, Cathy. Great points. Do you want to chime in here as well, Ganesh?
Yeah, as healthcare organizations focus on improving cash flow and reducing operational costs, here are some of the key trends currently shaping the field. Firstly, growing demand for RCM services. Increased use of third-party vendors for functions such as coding, billing, and claims management to leverage their specialist expertise and reduce their operational cost. Secondly, technological advancements like robotic process automation, which automates a repetitive task such as data entry, claims processing, and follow-up, reducing the manual errors and increasing efficiency. Artificial intelligence and machine learning enhances the predictive analytics, improves claims accuracy, and optimizes revenue cycle process by analyzing large data sets for trends and anomalies. Thirdly, the data security part. Enhanced focus on data security and protection against breaches, implementation of robust security measures to safeguard patient and financial information. Fourthly, the industry is moving towards value-based care from fee-for-services, which primarily focus on patient outcomes rather than the volume of services provided to the patient. Finally, the patient-centric approaches. With technology being the forefront, patient portals and self-service are in increased demand. Increased use of patient portals for scheduling, payments, and accessing health information is making easier for the patient as well as for the providers. Self-service options enhance patient experience and reduce administrative burdens. I just want to touch on the top challenges which the healthcare organization face today. First, the high rate denials due to errors, missing information, or policy issues with the insurance companies. Secondly, rising out-of-pocket expenses due to high deductible plans shifting more on financial responsibility to patients, complicating the collection process for the providers. Thirdly, consistently evolving regulatory changes, which again put in the challenges to the providers and the other entities involved in the healthcare. Fourthly, the data integration across various systems, like we have EHRs, we have practice management systems, we have coding software, we have patient movement tools. All these have challenges in integrating with each other. Fourthly, the labor shortage and talent retention, right? We have high demand of qualified people. So that's one of the challenges we currently facing in this industry. Ensuring that staff are adequately trained on new systems, processes, and regulatory requirements can be resource intensive. Retention and turnover is a major problem, wherein RCM rules can disrupt operations and impact the quality of revenue cycle management.
Wow. Thank you both for sharing your perspectives on the challenges providers are facing today. And I think you brought up a lot of critical points indeed: the staffing shortages, the rising cost, the increasing regulatory complexity, and definitely a lot of opportunity for the automation and the innovation, data analytics, and AI to emerge. So I think that's a perfect segue to our next question, which is all around the innovative solutions emerging in RCM. So given these challenges, Cathy and Ganesh, what opportunities or needs around RCM, automation, AI, predictive insights, intelligent applications, and workflow automation are emerging, and why?
So as Ganesan said, he's talking about that there's fewer people out there qualified to do the work. And it takes a long time to have somebody come up to the speed of somebody who's seniored in their position. It seems like to me that the United States has lost their motivation to work. I'm not sure where everybody went after COVID, but they certainly are not working now. We're accustomed to a vast number of people who wanted to work at the hospital because there were great benefits. Their scheduling was great, and they enjoyed working there, but they're gone. Organizations now have moved with automation. However, there are some things you cannot automate, and that's where they struggle every day. There's those budgetary constraints that we all have talked about are another problem, and they're not able to hire because they're not making enough money. So our hospitals struggle on both ends, not having enough people and not having enough money to hire the right people. If the hospital could hire, they struggle to find somebody qualified, as we've all hit on that area. Without those cogs in the wheel, and that's what I'm used to talking about, that revenue cycle wheel, if the one cog is missing, then the rest of the revenue cycle cannot do their work. And it is a terrific problem in all of our hospitals, no matter where I've been. We see that there's integration of intelligent apps that can provide real-time insights and recommendations. These tools help in identifying potential issues before they become a significant problem, which is helpful in ensuring a smoother revenue cycle circle, as I like to call it, the cogs in the wheel.
Absolutely. Thank you, Kathy, for articulating that. Ganesh, would you love to chime in here and maybe give some specific, really high value data analytics and AI use cases that you're seeing emerging here in RCM?
So we do have 3 stages in RCM, like from front end, then we have middle services, then we have back end services. So I'm just going to quote each of the examples, like how innovation is enabling us to deliver the expectations. The first thing is on the front end services, where we interact more with the patients, right? The patient meets the provider, get the treatment, and go back home, right? So currently what happens is that the patient has to reach the provider office, call or to directly to the provider office to get all the necessary treatment, right? And they also have to fix an appointment or to make any payments. Currently, due to this, they have challenges in terms of providing necessary inputs or suggestions or queries to the patients. With use of chatbots, right, for patient engagement, wherein AI-powered chatbots can assist patients in understanding their bills, insurance coverages, and payment options. This enables the patients to experience better way and able to reduce the overall labor cost for the providers and the process efficiency as well. In terms of the middle services, wherein the coding is a critical part, right, where we code the CPD or ICD codes to get the claim paid by the insurance company. So AI and ML algorithms can automatically review and assign medical codes to the patient records, significantly reducing the manual errors and improving accuracy in billing. The last but not the least is on the back end, wherein we get to see a lot of denials due to billing errors or missing information or to the policy issues. So AI-driven predictive analytics can identify patterns and trends in claim denials, allowing healthcare organizations to proactively address these issues before they lead to denials. As Cathy said, having the required resources with specialty expertise always challenges and retaining them. So these innovations are going to help us overcome those challenges and fulfill all the needs of the providers and the patients.
Fantastic, Ganesh. Thank you so much. Really exciting use cases that we're seeing emerging: predictive analytics and denials, the chatbots and patient engagement. So thank you for sharing some of those. And I think Cathy also mentioned it too. A lot of these are coming together, being operationalized in that idea of the intelligent app concept. And as many of you know, we have our trademark concept, the digital knowledge worker. I think a whole other separate topic that we can go deep into later. I think there's a whole other webinar on that. So feel free to check that out on how we're balancing these human expertise and AI, the rise of the digital knowledge worker in business operations, just like this one, like RCM. So given that we're seeing this evolution of the human-machine collaboration powered by this technology, powered by digital knowledge workers, by intelligent applications, how is this impacting the future of work for all jobs related to RCM? Let's think about this. Cathy, would you like to kick us off with some thoughts?
Sure. I would like to share with you all that AI is not here to take jobs. That's the most important point I want to make. It's here to enhance the work of what they're already doing, especially when there's not enough people. This is why AI was developed, to work smarter, not harder. Reading the file and allowing nurses to work on other things that they know how to do best, like taking care of patients. So it'll alleviate those nurses from just trying to read and apply things that could be done by AI. They could get back to more patient care. As the patient presents to an area for care, pre-run the insurance. AI could do that. No one needs to touch it. In the case of an outpatient procedure like a mammogram, is a good example, scheduled in months ahead of time, and the provider should know on day one who the correct payer is. This step supports getting paid faster. So send that payer over to mammogram order over to the payer, and the payer will have that information on the day that that's going to be done. And it'll be faster to get the payment on the back end. Potential for more accurate coding. Humans can miss rules and regulations. And as you all know, these rules and regulations change every year. AI automatically reviews denials as they are presented to the organization. That's another great place to put them in, and can make suggested corrections. And it would move it faster to appeals. When you have a human do this, it's a tedious, long process. And the vast majority of the healthcare organizations' decisions are made by humans when they choose to accept a denial or they choose to appeal it. AI can be used in that decision and replacing the human when to accept or the appeal or the denial, so that there's no more human error in the case that's appealed. What I've seen is we get paid on one patient care and not on another that I thought for sure was going to get paid, but AI could appeal them all. AI can support the decision making and have a great impact on the reimbursement.
Absolutely, Cathy. Thank you. And I love that you hit on that point. With AI, it's not about replacing jobs. It's about delegating that tedious and repetitive work to the intelligence system. And you can elevate the human role, in this case, the nurse, to do what they do best, what they love to do most, which is focus on patient care. And that's really what's going to drive the outcome. So thank you so much for sharing that. Any thoughts you would like to add here, Ganesh?
Yes. So AI is here to stay, right? As Cathy said, AI is enabler, right? It's just a supplemental intelligence to that human intelligence. So it is already enhancing the efficiency, improving diagnostics, and personalizing patient care. So I just want to throw up some example here where AI is capable of doing what is expected. So in an hospital setting, when a patient meets a doctor, right, he is supposed to get the treatment for the illness found. So generally what happens is that the patient and the patient doc meets, it's called as an encounter, wherein the physician addresses the needs of the patient by diagnosing medical records, understanding the illness or symptoms the patient has. Based on that, he generally captures those information, which is called clinical notes, in a standard format called SOAP, which is used across by most of the physicians and specialists in the structured way. So what does AI do here? So AI-powered medical scribes can easily understand those formats and can convert those conversation between the patient and the doctor into written text, which will help us to code in a much faster way and accurate way, thereby eliminating any human errors and also a timely submission of claims, which in turn will help us improve the cash flow to the providers. Another scenario, presume that if the patient is not able to capture in a structured way, even there AI can help us, right? Even if you have unstructured data, a branching algorithm called NLP, right, Neuro Linguistic Programming, which help us to interpret unstructured data and code those into standard codes based on the clinical notes captured for the relevant information coding. So this automates the conversion of the narrative description into standardized codes. So this again in turn shows that what's the AI capable of, and again it's going to be a supplemental to the human intelligence. And last but not least, the predictive modeling based on historical data, right? And in the backend services, we do have challenges of managing denial, right? The one critical part is denial management, where we get to see a lot of denials from insurance companies, right? It could be like billing errors, or could be coding issues, or because of the policy issues. So this particular tool can examine thousands of past claims to identify common factors leading to denials, such as coding errors or missing information or policy exclusions, which provides predictive insights and flags the claims at high risk of denial before submission, thus allowing us to being a proactive approach to make necessary correction and submit the claim, thereby improving the efficiency of the process, there in turn improving the cash flow of the process. So this proactive approach can lead to less denials in turn and reducing the revenue leakages and improve the overall efficiency of the process.
Thank you so much, Ganesh, for those exciting data analytics and AI-infused examples that are not only practical in the RCM, but how they lead to direct dollars with reduced revenue leakage, improved cash flow. So that is super exciting. Thank you. Now, given that we're already seeing a great burst of automation, innovation in RCM, I would like to ask you both, what is your hope for the future of RCM? Cathy?
Well, I would hope that the revenue cycle management will become less skeptical of AI. We know that it makes mistakes. We lose more money with payments. They worry about it won't have the correct insurance details. But there are places for AI everywhere in the revenue cycle. Pick and choose. If you have something that's working well in your revenue cycle management, don't change it. Let them do that part. Where you need help, think about some automation. There's less budget for people because hospitals aren't making as much money as they used to, and consider how AI may be able to help you. That is my hope. Coding is another area that we have a challenge with. Our older coders are retiring now. They've done a great job. They've kept up with the rules and regulations. Our new coders are young. They lack experience. Payers change their rules once a year. Here we go again in October. And AI can help supplement what you're currently doing. Let's plug AI support in for the team, not to take away jobs from the workforce. They're working really hard, these folks, who are working. There's just not enough of them, or they may be young in their jobs. Place for AI in the front end. Why not send that patient's information off to the payer, but with AI? It saves a step on the front end. I wish they could do this with Medicare, but they can't. That has to be done on the back end. But use AI to supplement medical reviews. It can read the record and apply the criteria the way the utilization review nurses do. And then instead of having them do that, then let them do some other part and piece of the revenue cycle or patient care. Why not put that nurse back into that patient care is the question I always have. We don't have enough nurses on the floor. Criteria is strict, as we all know. Clinical documentation improvement is a whole other ballgame that I've had the right to work with them. And they have to read the record to look for the physician's missing documentation. They need the specificity of the record, and the diagnoses are missed, which then they cannot pay for. And they have to find the intricacies in the surgical reports. So that might be another place where you can part and parcel AI into the medical record. During my career as a mid-revenue cycle expert, I have been blessed to work in all but 4 states in the United States. I'm pretty proud of that the companies that I worked for sent me all over the United States. Hospitals are struggling across the country. It's just not one hospital, it's everybody. Last year, it was a hospital in Delaware. The struggle deepened since COVID, and there have not been enough qualified people to work. As you know, we talk about that in the newspapers every day.
Thank you, Cathy. I absolutely love that and echo your thoughts. I hope that we can embrace automation and AI and these intelligent systems, and we can unburden these nurses, help keep these hospitals open, and help the nurses focus on patient care, like you were saying, because that's the one thing we don't want to automate. We don't want to remove that human touch from. Your thoughts, Ganesh?
Sure. Just want to add on a few other technology advancements which you see, right? As we already talked about AI and how ML improves the process. I just want to quote an example, right? In a scenario where in hospitals, like, we get to see a lot of patients in a day, right? Thousands of patients has to be seen, and that data is used to verify and to have the charges into the system. So the challenge again is coding accurately, right? We have to ensure that the codes which you use, whether ICD or CPD codes, are accurate, so that we can able to get the expected payment from the insurance companies. So the one such scenario is that AI helps us to code those CPD codes, ICD codes, based on the information available in the patient charts. And again, the other scenario is that patient-centric RCM, right? In the earlier days where patient has to meet a doctor, right, by scheduling appointments, by calling up the front office. Now, with the advent of patient portals, they simply can log into the website, or using the mobile apps, they can simply look at the schedule of the provider and see which particular day they would like to have an appointment. Based on availability, they can easily fix appointment. Not only that, they can easily make payments, right? Prior to that, they have to go to the doctor office to make any payments, whether it's a copay or co-insurance or deductibles. Now, with the tip of the finger button, they can easily make payments, which enable them to know like what's the actual balance for them, right? By clearly able to see the copy of EOBs, right, with the explanation of benefits. So all these innovations are helping us to make this process better for everyone involved in the RCM cycle. And the one other thing I want to call out is on shift towards value-based care, right? When we started this industry of healthcare, primarily most of the insurance were following the revenue model called fee-for-service, wherein each of the services rendered by the provider are paid by the insurance company. Then it moved towards managed care, wherein the patients seen by the doctor are paid based on the cumulative basis. For example, like if the patient is assigned 100 patients to be seen in a month, if the doctor sees those patients, based on that, he will be getting a capitation payment. Now comes a value-based care. So it doesn't bother about how many patients you see. It's more on how much of value you added to patients based on the reimbursements. So it also enables to manage the population health of the people and citizens in America, right? And then finally, the data analytics and insights, right? So any part of job or any process, you need data to make informed decisions. So these advanced technologies and data analytics help us to get greater insights so that we can able to make informed decisions. And then finally, get to see a lot of application coming in every day, right? We have RCM platforms, we have this coding tools, then we have this patient portals. All these tools are working as silos. So there comes the challenges for us to integrate these information, right? So that everyone get involved can get the required data. So this again is another challenge which we're looking at, and this enablers of advancement and technology can useful for us to make this a better place.
Wow, thank you. You have painted quite a bright future for healthcare and RCM, and it's so exciting to hear all these technology integrations and how they're leading to these patient-centric approaches that, as you mentioned, are enabling better value-based care, which is really what matters at the end of the day. So thanks, Ganesh, for sharing some of the innovative solutions that are helping everyone work more efficiently, accurately, and with a patient-centric focus to optimize the revenue cycle process. But, you know, we might have some skeptical folks here. So let's keep our feet on the ground. And why don't you tell us a little bit more in detail, specifically, how have you been able to help drive some outcomes for a specific client? What kind of outcomes can people really expect?
Sure. So before I just dive in, I just want to give an example like what generally happens in a hospital setting, right? So they have around like 150 bed facility, which is located in suburban area. Like they have to see a lot of patients in a day. Could be like thousands of patients. So what generally happens is that once the patients are seen, then we have to ensure that those eligibility details are accurate, whether the patient is active or not, what kind of benefit the patient has. Does the patient have any coverages such as limitation, exclusion, or they have any patient responsibilities such as copay, co-insurance, or deductibles, right? So previously, we used to call the insurance company, right, and get those details, and it's time consuming, right? It's going to take a lot of time. Or we have to go to the insurance portals and start looking at the information and collect those information and put in the system before billing a claim. But now, with use of AI technology, all these are gone. Okay, so now this hospital has decided to implement the AI-driven automated delivery system by utilizing the EHR, which is called electronic health records, and the RCM systems. Based on that, they're able to easily retrieve the data from the payers. They just send the query with the list of patients per day. Assume that we have thousands of patients. They simply prepare a list and what are the information you will need and send those queries to the insurance companies. And based on the AI system, they will be able to pull up all the records from the insurance database and match those and provide all the information such as eligibility, benefit information before even the service was rendered. So this is a great opportunity for us to utilize this tool. And again, they also provide real-time updates wherein instant update on patient coverages, including details on copay, co-insurance, and deductibles. So I just want to quote on the results, some of the results, exciting results that the AI could deliver. The first thing I want to just highlight is on time savings. The average time spent on eligibility verification per patient is decreased from 30 minutes to 5 minutes. So resulting in a time saving of 25 minutes per patient. Think about it. How exciting is it, right? So again, in terms of labor cost, they were able to reduce time spent on manual verification. So again, as I earlier said, 25 to 5, which helped us to save almost $450,000 in annually for labor cost. Not just that, we also improved the accuracy based on automated eligibility systems and reduced the errors by 55%. Next, on the denial part, the claim denial rate due to eligibility were dropped from 10 to 3%. And to top of that, we absorb all the revenue increase. The improved accuracy and speed led to an estimated annual increase in the revenue of approximately $1 million due to fewer denied claims and faster processing. Not just that, they also streamlined the registration process. The patient experienced a faster and more efficient registration process by reducing the wait times and improving the overall satisfaction of the patient. Thereby, the patient coming back to the doctor to receive the treatment. In time, the cash flow. Finally, the transparency. Because of the real-time eligibility updates, the patient can easily know how much is owes and what are the clear responsibility he has to pay. This is enable both the patient and the provider to be happy and able to serve the community.
Wow. Incredible, multi-pronged benefits, truly. I suppose I'll let Cathy, as the industry expert, make any final comment on those metrics as the industry expert here compared to the benchmarks, but I think it sounds quite impressive and incredible.
I just want to remind everybody that this wasn't a small area that where Ganesan's AI tool helped promote this $1 million. I know that AI can't be used across the hospital system because you do have people that are working really hard, that we're not here to say that those folks should go away. We're just saying that maybe you want to hook into AI to help your revenue cycle stream flow a little bit faster. Less people is not what our argument is about today. Our argument is about helping you help yourselves. With the 18 years that I was a revenue cycle SME in the mid-revenue cycle, I often found it very difficult to hire coders and utilization review nurses and case managers. A lot of the hospitals out there are using social workers for case managers. Case management is probably one place you will not use AI. We need that patient to case manager to go with one another and make a plan for their post-care. And a lot of our patients cannot make that themselves. They don't know what's good for them to take care of. We do need a people-to-people relationship there. But I see plenty of this. I don't know whether I've even told the two of these guys this, but I'm going to tell my story. When I was in the revenue cycle, and when I first stepped out, I worked for a smaller company, and we had a tool for clinical documentation improvement. And I said to the gentlemen who were on the tool working with me, the guys that really knew how to build that infrastructure, I said, we'd really make a big effort here if we could make that thing think. And so it came to be here 15 years later that we have something that can help people move quickly through their daily work. And now that we don't have people, it's even a bigger blessing to the hospital. So, I look back and I think, wow, 15 years ago, I was on to something that nobody believed that we could do. However, I thought about a plan for that tool and presented it, and it didn't go anywhere, and that's okay. Now we have things to help our folks in the hospital. That's my hope, that these people will work smarter, not harder, and that your hospitals and your outpatient clinics will thrive in this kind of a regulated environment that we live in now that I didn't live in 15 years ago.
Oh, thank you, Cathy. I'm so glad your vision from so long ago is finally blossoming and coming to life, and we're here with you and collaborating on so many exciting things. So I think that's a beautiful note to conclude on as well, touching on the criticality of the humans as well in this cycle. And it's all about the human-machine collaboration, finding and enabling them to each do what they do best. So thank you so much. We have now concluded today's prepared Q&A, and we are going to go into the open Q&A session. So please feel free to ping me, ping the hosts and panelists, or everyone in the chat your questions, and we will begin going through them now. I already have a few flowing in, so I'm going to begin just firing them off here, and we'll let our speakers take them up. So the first one is around, I think, follow-up to the amazing success story Ganesh was taking us through. It's all around the results, the timeline they can expect. So tell us, Ganesh, and when can we expect to see the results? How fast?
Certainly. So the performance optimization and measurable gains you can see in 6 to 12 months period. And for full optimization and continuous improvement, it could take up to 12 plus months. These timelines can be shorter or longer, depending on the complexity of the AI solution, the readiness of the organization, and the specific goals of the implementation.
Yes. Thank you, Ganesh. I think that helps. We're looking at the next question here. Can I just select parts, or do I need to do all of the RCM wheel? I think we touched on this a little bit, but maybe we can recap it here. Go ahead.
Sure. Yeah. So you can choose to outsource any service you want. It could be like point solutions, where you could choose only the patient eligibility process, or you could focus on only the coding, or you could handle only the AR part, or you want to provide outsource to end-to-end based awesome solutions. By focusing on your specific components, you can able to address the pressing issues more effectively and can manage resources better. So, however, as an RCM service provider, we would like to you to outsource a comprehensive approach of by having the end-to-end RCM. Eventually, it includes all the parts of RCM process. We typically yield the best long-term results.
Thank you, Ganesh. Thank you so much. And now some questions around where is the team?
So we are based out of headquarters in US, and we do operations in India, Philippines, Colombia. So you have the opportunity to tap the talent pool across the globe, right? Access to the specialist service skills, whether you want to multiple specialties, right? Whether you look for orthopedic surgery or internal medicine or gastroenterology. So all these can be available. And we have a very good system where you can be able to scale up, right? Based on your enterprise needs. And we also operation across time zones.
Thank you. Yes, I know many diverse talent pools and specialized skill sets that we can tap into for each region to really get coverage 24/7, 365. So that is exciting. And you touched on it a little bit here, but a follow-up question, what specialties, inpatient, outpatient?
Yes, we can do billing services for multiple specialties, as earlier pointed out. We could do orthopedic surgeries, we could do internal medicine, gastroenterology. We do specialties on complex claims such as WC, workers' comp. We do a veteran administration. Then we have other insurance services, commercial insurances. So all this can be done. We can do both professional as well as institutional billing. The professional primarily handles the patient part, where institutional we take care of the hospital billing, technical components.
Lovely, fantastic. And another question coming in here, I think the last one, and here for Ganesh, and then we'll tee it over to Cathy. How do you learn the system and put it into place? How much training do these AI-infused intelligence systems require?
Yes, as I earlier said, like these systems going to be a supplemental to human intelligence. So when we opt for a fully automation, there will be no training needed. The human will be elevated to a much bigger role to make a critical judgments, decision-making process, to review, to make any exception handling, and also to look at the KPIs, right? What kind of benefits metrics we have to observe. And in terms of predictive models, that will give you the insight to make informed decisions, right? And also provide a good user experience.
Thank you. Absolutely. And one final question now here before we wrap up. Oh, I love this one. What's the biggest value other than the revenue? Cathy, let's wrap it up with some final thoughts here.
I think that the employees will be happier. They will have less to do. They'll make less mistakes because no one wants to make a mistake. They're not doing that on purpose. If they send a Humana to the Humana 1 is my example, when it should go to Humana 2, they don't do those things on purpose. They think that they're doing the right thing. And I think that will make our employees happier. They're going to want to stay at the hospital and work. They're going to enjoy their work process more. They're going to find great gratitude in the dollars that they got last year in 2023 and the ones that they captured now in 2024. That really makes the employment, the folks that are the employees happy that they're doing a good job. I think that it'll raise and boost their morale. Right now, they get sad when they don't do things right, or they think that they did it wrong, because there is no wrong. It's a hard day at work today.
Absolutely. Thank you so much, Cathy. Beautiful final comments here. And if there's no more additional questions, I would just like to say thank you to our speakers. Thank you to all of you who joined live to tune in today's discussion. We hope that you learned something and enjoyed and are inspired and going to challenge the current state of your RCM. And so, of course, to accelerate, and if you ever need help, please feel free to reach out to us. I'm going to ping the email in the chat, contact@kaviglobal.com. Direct line to Ganesh here, myself, many others are monitoring. So please feel free to reach out to us. And with that, thank you so much, everyone. Have a great rest of your day, Friday, and take care. Enjoy the week and tune in next time.